So there's a lot going on in healthcare, but I think it's important to understand the dynamics associated. There's consumer-centric technologies, and there are also provider-centric technologies, right? So before we kind of jump into big data, evaluating these pieces and looking at them a little more closely. So social health, mobile health, and I'm sure that those terms are tossed around quite a bit. Telehealth, personal health, rating and shopping. These include scheduling to health and wellness to just remote monitoring. And then you have the other component where it's practice-centric, whether it's service provider, security, revenue cycle management, information health management. So it's the integration between the two. You can't have a Fitbit platform and not be able to incentivize the doctor to use or have a reason to look at that data. Right now they don't have that incentive. You can't take your Fitbit Excel spreadsheet and email it to your doctor because he's not going to look at it. If there's an insurance company that provides an incentive to say, hey, look at this individual's information, then there might be something of value. But currently there's no structure set up there. And then emphasizing big data. I think it's a term that's really tossed around a lot. It's exciting in terms of from the healthcare aspect of things, but focusing on collective power of information, being able to look at this consolidation of information and making sense of it. That's a great way to approach identifying issues and resolving those concerns, especially within healthcare. But I would emphasize using a different terminology. I would say focus on actual data, because there's so many layers of data that most folks, especially practitioners and healthcare providers, they don't know what to do with it. And I think starting with actionable data makes the most sense. And there's a lot going on. There's a lot of potential involved, whether it's from the clinical end or it's focusing on public health. Every day we're acquiring a lot of information, whether it's through the Fitbit device or your Apple Watch, or if it's through the scale that you use that has a Bluetooth capability and wireless access. So it stores all the information for you every time you step on the scale. The important piece is making that relevant. And we're making strides. As you can see, we've moved a lot more towards personalized medicine. We're gradually moving away from this fragmented, archaic system to something that's a little more integrated. And then the emphasis, when we talked about provider-centric to patient-centric, that's a huge pain point. And the human element is oftentimes missing there, as opposed to just diagnosing someone with a specific condition. It's looking at the individual's life holistically, looking at the caregiver, the stakeholders involved, if there's a family history, and getting those individuals involved too. So it's not just this one narrow-minded campaign for health and wellness when the other physicians for that individual are not participating. That's great for generating revenue, but it's not great for patient care. And then the other piece is community-based, outcomes-based, and that's a big one. It's revenue, fee for revenue model, essentially, and that's the way things are going right now. And as opposed to treating sickness, preventing sickness, so preventative care, and emphasizing that. And just by a show of hands, one of my favorite parts here is kind of picking people's brain and trying to figure out what they think. How many folks here think that health tech focused wearables are part of the future? People will use this Fitbits every day, and ordinary people will hop on board. Okay, sizable. I have mixed feelings about this because you don't see a 400-pound, 5'3" female wearing a Fitbit, right? The individuals that should actually be using these devices are not, as opposed to a 25-year-old male who's in great shape and wants to look hip. That's kind of there's this disparity there, and I think incentivizing people who actually should be using these devices and having metrics in place with incentives for the providers and the stakeholders and the caretakers involved, that's of relevance. That makes wearables much more relevant in preventative care and health information in general. And that's kind of it's kind of where we focus: preventative care and health and wellness. My focus, my emphasis for co-founding the startup was to alleviate this pain point where individuals are not able to find providers, healthcare providers in their area quickly and efficiently. And I guess if you had to ask for my bump pitch, I would say, MedNav is a location-based platform that allows you to find providers in your area, so you can see live wait times, traffic times, etc. And that's kind of the emphasis of the platform in general. So how does it work? And just as importantly, what does it do for patients? So our focus is, it's a mobile health app, location-based. We want to be able to integrate with EMRs and EHRs to show the appointment availability and alleviate that concern. So a lot of doctors don't go to medical school to focus on marketing. They go to school for patient care. And that's kind of the focal point there. And we want to drive utilization to their locations using our platform, which we've created in a very dynamic way so we can have an enterprise component of it. Right? So similar to my analogy previously about Blackboard, if we come across an organization or institution that sees a need for location-based search, we would be willing and interested in partnering with them, whether it's a health insurance company that has a large user base, member base, and right now all they have is a directory. They don't have a location-based platform that allows you to see live wait times. That's something we would look into. So just to show you quickly, if the internet works. So we made user experience was the biggest piece when we started development on the platform. We want individuals to be able to put in their location, their desired specialty type, and then their insurance information as quickly as possible. So if you were to think of kayak.com and Uber kind of combining, that was the mindset we approached the platform with. So now you see an output. You'll see the location-based piece of it, and you'll also see the healthcare providers associated. You have the ability to leave a review for the individual. You can also use the map piece there. So once you click book now, this is one of the things we really value in our platform. We want to alleviate that concern of user experience. A lot of the times when you walk into a doctor's office, you fill out a form, and it takes 10 minutes to fill out. We want to streamline the intake process and kind of fix that for you. So whether it's direction taking or the intake form or rescheduling your follow-up visit, those are the things we focus on. And that's how we structured our platform. So if we come across the opportunity to work with a lab services company for drug testing, or if it's a health insurance company, that was the mindset. And that's been the feedback that we've received quite a bit in terms of the value of the startup. And I'd be willing to talk to you about your questions if you have startup ideas of your own. Tell you a little more about MedNav there. And our value proposition is pretty simple. So we're looking to save full-time employee hours on the provider's end, send out satisfaction surveys for distribution. So again, they don't have the time to do this, and they need a way to have metrics associated, especially with the passage of the ACA. And then down the road, look at big data and practice optimization, so we can look at why people are making those appointments and where they're going, kind of use heat mapping on the platform to figure out what are the keywords and the main needs, the primary needs. And the co-founders from the team, so Parv, Lex, and I co-founded the startup, and Parv's here today. And we're comfortable with who we are. We're a joke within the team is, the grandfather in the group is 30 years old. So, we look to have seasoned individuals work with us in conjunction, with the team, with the interns that we've hired. These individuals have either acquired or sold startups or have worked with startups in the past. And we're very fortunate to have them. And I think one suggestion I give to everyone is don't go for yes men or women. You want people who can give you constructive criticism and back you up when you need it most, as opposed to just agreeing to everything you say. And that's it. In terms of accomplishments, we recently came in third place at a Chinese investor pitch competition, which was a great opportunity. And from a social entrepreneurship standpoint, they saw potential in the platform in terms of scalability in China, right? So a lot of doctors in China don't have EMRs. They don't have any fancy gadgets. All they have is the internet. So after the 10-minute presentation there, one of the judges actually asked, how would you replicate this platform there when they don't have an EMR? And for us, that's a great opportunity because we're a location-based, web-based solution. So the doctor will have a service application, kind of like Skype, where you can double-click, and once you see a notification, it'll pop up saying you have an appointment. Once you click on that, it'll redirect you through your native browser to your profile as a doctor. So you'll have a calendar, and it'll show you, I'm booked, I'm booked, I'm booked, and you have the option to double-click and say you're booked or away, or change any of those pieces. On the front end for the user, that's what the user sees. The user sees whether you're available or not and the wait time. So it refreshes. And for us, that's great in terms of scalability. And we're looking forward to seeing where that conversation goes. And that's all I had. Looking forward to your questions, and thank you.